Hi, Mr. Wright. How are you today?
I'm good. How are you?
Very good. Thank you for coming in today. So we last saw each other back in September. So what I just want to get started to do is just review your medical history. Do I have your verbal consent to do that?
Yes. Yeah.
Excellent. So when I was reviewing it, it was saying that you have COPD. Is this still something that you're being treated for with your doctor?
Yes, I'm still being treated for it.
And are you taking your medication regularly?
Yep, as I'm prescribed to, I do.
Excellent. And it says here in your chart that you do smoke. Can you enlighten me a little bit about your smoking routine?
Well, since our last appointment, I've cut back to 9 cigarettes a day instead of 10, and I think that I'm kind of trying to quit, but I haven't done much except for just drop down to 1 less cigarette a day. I need a little bit more motivation to quit more, but it's something I'm considering.
That's great. I'm really happy that you took it upon yourself from our conversation to at least stop the one. At what point in the day do you find like you can eliminate that 1 cigarette?
Usually like the morning. I wait a few more hours before I have one.
And is work still the stressor for you for your smoking?
Yes, it more so is.
So if you were to try to stop decrease your cigarette intake at work, how do you think you would work through those struggles?
I'm not entirely sure, but I maybe like have something else in my hands.
Okay, I know that you mentioned that you've quit before, and it's for short term. Can you tell me about that experience?
It just didn't go so well. I just wasn't motivated enough back then to go through with it.
Okay, so I can go over some motivational techniques and some breathing techniques as well. And did you look over those pamphlets that I provided to you at your last appointment?
Yes, I did. They were helpful.
Okay, and you remember the indices that we went over when we did the exam, and we looked at the oral manifestation, so what happens to your mouth when you smoke, and then when you have your COPD. Do you remember that, or would you like me to show that to you?
I remember it. Yeah.
Okay. Did that impact anything about our conversation that we did have?
A little bit. I thought about it a bit after.
Okay. Do you think you would have a little bit more time to discuss this further?
Yes, I have time.
Okay. So let's just review a couple of things. Do you have a couple minutes to do that?
Yes.
Excellent. So what do you think some of the reasons for your smoking would be, like reasons why you would want to quit? You composed a list of whys or rationale behind that?
Well, I know my wife would really appreciate it. I've been smoking for years and she's never really loved it much, and I know that there's a lot of benefits I could get from quitting.
And can you expand a little bit more on those, the kind of benefits you would see?
I know my teeth would get better. You told me that.
That is true.
I wouldn't be so winded when I walk up a flight of stairs, I'm sure.
So you understand the relationship between COPD
Yes,
and smoking cessation.
Yes.
Okay. All right. So you understand that, the level of COPD with your medications and smoking, your oral health is at a decline. And me as your oral health advisor, I would want the best oral health for you and physical health. So we're just going to review some of the reasons why you can do better about not smoking. All right. But I did pull out some information here for you. You seem pretty motivated to quit. I know your wife would see that, but from internally, what kind of motivation do you think that would get you through some hurdles?
I would need someone to keep me accountable. My wife could do that probably.
I would love to be in that position to help you. I think
would
that's
also be helpful.
very brave of you to make that first decision in order to quit smoking. I do have a lot of evidence-based materials that I can present to you today that you're more than welcome to take, and different information to read at your leisure. Maybe by the end of today's appointment, we can actually discuss to see if you have an end date of when you would like to stop smoking and start the cessation. Is there anything that I can help you with? Like, have you talked to friends and families? Do you need me to refer to a medical doctor about possibly using, let's say, the nicotine patch or an inhaler?
I don't want to try any of those, but you could help me come up with a plan and a goal of when I'm going to be able to fully quit.
Okay, and each goal is individual as well, so definitely we'll work towards that. Can you also list maybe some oral manifestations that we talked about before that you would have in your mouth from the smoking? So that might be part of a goal that would help.
I'll probably have like more of a dry mouth.
Mm-hmm.
I might even have bad breath, or I don't know, my teeth look kind of gross, my gums aren't the greatest. You've told me all those things before.
Yeah, and so also when we're quitting smoking, so some of those will decrease, right? And also with that, we'll also maybe see some nicotine stomatitis and nicotine stains start to dissipate the less you smoke, because it's going to be a gradual thing. So I know we were kind of more on the high level with your coated tongue. So we'll slowly see that decrease for you.
Okay.
Excellent. I'm just going to look at some information here to see what I can provide you with. Okay, so there's some things here that I would like to give to you about some reasons for quitting. I'll give you a few moments to read that over. I'm just going to make some notes here in your chart. So when we reassess in the next little bit, or when we're in connection, we can go over some of your whys, and that may pull you back into, if you're having any hindering thoughts or feel like you're going to relapse, we can pull these back to the whys, and we can, you know, strive to find a new goal for you. So just take a few moments to read that while I document some notes here for you. Can you relate to anything on there, sir?
Yeah, a little bit. The health and appearance reasons I can relate to.
Excellent. Now, I know that you have COPD and you've had it for quite a long time. So I also did some research about COPD and the link to heart health as well. So they also have a good program that will help aid in smoking cessation. So this is a great resource to do it. Also, when we do talk about some more benefits of tobacco use, I've listed them here for you. So then it provides a little bit more motivation and education for you as well. And we can also discuss this in further when we chat about a week before you decide to stop smoking.
Okay. I can take this home?
Yes, this is
I'll
all
put
for
it
you.
up on my fridge as a daily reminder to myself of the benefits of quitting.
That's great. I also wanted just to let you know that there is going to be some hurdles with stopping smoking, since you've been doing it for quite a long time. And one of the main things that a lot of my clients say is their cravings. So in your mind, we have to know that a craving is only going to last 20 minutes. So I printed out some different types of techniques that we can work together through about dealing with cravings, irritability, some anxiety and depression and mood, because it is a stimulant to your mind. Do you think that you and your wife can work on some of these together to find out some different ways to work through that?
Yes, I think we can.
Excellent. Have you ever tried quitting before?
I did very many years ago, and it didn't work, and then I never tried again.
And what were some of those factors that hindered your success?
Well, the cravings, I gave in a lot, and social reasons, everybody else that I knew was doing it, so it was hard for me to quit as well.
So how do you think that this time will be different from previous times before?
I think I'm more educated on the benefits of quitting and realize that I actually need to quit now, and I think I can do it this time.
And now you said that a lot of the smoking comes from work, and you're going to be in that atmosphere still. What are some different ways that you think that you'd be able to still be in that environment but resist those nicotine cravings without being on a supplement to help with that?
Well, when my buddies and I all go out to smoke and break, maybe I could like chew gum and like have a water bottle in my hand or something, so I have something in my hand still.
Right, and you could chew a nicotine patch. You could also chew a xylitol gum as well, and that'll help with the remineralization as well for you. So those are two good things that you can kind of alternate through to help your oral health as well. Right, I think that everything is going well, and I've assessed all of your concerns. I do feel like you're quite prepared this time to stop your smoking, which makes me so happy to hear. I love to be part of this journey and working with you, as well as working with your oral health and your physical health as well. I know you said you wanted to kind of try to do cold turkey. In the past, I've had quite a high success rate with patients starting off with nicotine replacement therapy. I can send a referral over to your doctor if you like. Would you consent to that?
Yeah, I'd like to
It
know
doesn't mean
more
you need to
about it.
proceed,
Yeah.
but it's good to have the education. As you
Yes.
said, that was the default from
Mhm.
before. So you can use, basically it helps you to stop smoking about 55% within the 8 to 12 weeks.
Okay.
What kind of range are you looking to seek for to ending smoking?
I feel like I could do 2 months, I think.
About 2 months or so? Okay, great. Are you aware of different types of medications that are offered, such as Champix, Zyban? Are you aware of any of these at all?
I'm not that aware of them.
Okay, well, I'll give you some literature about it so you can read it. So when you go to your medical doctor, you can ask them any questions at all and how it would affect. If there are any side effects with your COPD, they would be the ones to advise that as well. We did talk about the gum as well. I think it's great because you said that would help in some
Yes.
social situations, or some lozenges as well. Now there are some side effects to medications, and there are some oral side effects as well. So even if you decide on one, please give me a call and we can discuss those as well. Would
Okay.
that be okay?
Yep, I can do that.
Excellent. So I also wanted to give you some referrals to some support groups as well, so you can do some more research. I've worked personally with a couple of these, and some other clients have had some success as well with them. Okay, let me just go over those resources with you. Alrighty. So over here, I do have some different referrals here. There's even, if it's a concern for you, for some financial support and some different resources that I can speak with the pharmacist too. You're from the Halton region area, so I pulled up some resources here that'll be local for you as well.
Okay.
There's also a toll-free number here, and there's also a website in which you can get support from an app. So kind of just text your symptoms or what's going on, and other leaders will be there to help guide you through a certain moment, or if you're having a craving, you're feeling anxious or depressed, or one of those kind of situations here, and you would like some assistance, you can send them a text 24/7, and there'll be some peer support group there for you.
Okay. Yeah, I'll definitely look more into that.
Excellent. I think these are great resources for anyone and any time.
Yeah.
All right. Even if your wife is having a concern and she's not too sure how to deal with your mood, she can even go to these resources, and it can help you and help her work together on this, right?
Yeah, that sounds
Or-
super helpful.
Any questions that you have for me, I can also refer you as well. So I'll also even just put this little binder here together, some milestones for smoking. So let's say like within the first day of your heart will have a risk of heart attack within the first day or so. Within 48 hours, you start to get your taste buds. So I really, really would like you to work on that tongue scraping that we went over as well.
Yeah.
So then again, here are the apps and a forum as well.
Okay.
Okay, do you have any questions at all?
Sometimes I smoke because I'm more stressed. Is there any ways that I can better cope with my stress other than smoking?
Absolutely. I've also provided you some information here with some positive ways to overcome stress.
Okay.
There's not just one single way. It has to be an umbrella effect, right? Because this has been part of your life for so long. I know you have a lot of social events that you go to with work, and everyone smokes there.
Yes.
Have you thought about different ways in which you're going to handle those situations as well?
Not really a lot, but like I've said before, having something else in my hand might help the need to be holding something.
Excellent. That sounds great. I'm really happy that you're already kind of thinking and you're barreling down with that kind of mindset. I find as well, just taking a moment, stepping away, and just like doing a couple of deep breaths really helps me when I'm stressed or I'm going through an anxiety or just need a little bit of time to focus on what it is. And then I think about like my why. Why am I doing this?
Mm-hmm.
And knowing that it's only going to last 20 minutes. So yeah, have a glass of water, or if you're at home, do some jumping jacks.
Okay.
You'll get exhausted and tired, and then you will
Yeah.
not want a cigarette.
Okay.
Back to those ways to overcome stress. Find someone who you can talk to. That could be me, that could be your wife, it could be a fellow colleague.
Okay.
Okay? Then you can relax by soft music, reading a book, or doing yoga or taking a walk. Are there something like that, habits you might even pick up?
Yeah, I could do walks on the weekends or something.
Right? And the most important, I think, is rewards and accomplishments, right? So that goes back to that page as well about rewards as well. So give yourself a little treat here and there of what you would like to do.
Okay.
All right, and maybe become a little bit more physically active. It might be a little bit tricky in your situation because COPD, you already have a little bit harder times. But yeah. Mr. Wright, I'm very happy to hear that you're open to talking about smoking cessation, and you just need a little bit of motivation. Do you recall this pamphlet that I went over with you at your appointment?
Yes, I remember that one.
Okay. Have you had a chance to look at that or any information about it?
Yes, I looked at it a bit after our last appointment.
Okay. Not a problem. There's also something that I would like to also show with you. Maybe it'll help you open. Help for smokers and other tobacco users from the local region. So it just gives you some tips and a little bit more motivation that you can find within and maybe some external sources as well. I know it's really hard, and we did discuss about cravings and how it's only for 20 minutes or so. I've had a lot of success with other clients. They just say they kind of breathe through it, but that might be a little bit trickier because you say with the COPD, you already have some breathing issues. But what about walking or different things like that?
Yeah, a walk would be okay. That's not too bad for my COPD.
Right? Okay. Also, let's go through here a little bit more. Some good reasons. Do you have some reasons in which you can think about that would help you to create some more motivation for smoking?
Well, it's bad for my health. It's not good. I can't breathe as good, and my wife doesn't like it so much, and it's a bad habit that my children will take on too.
Yes, we do want to prevent that as well, right? You did tell me that you were planning a trip for you and your wife. Are you excited for that?
Yes.
Would you use that as a motivation maybe?
Yeah, I could. That's a good idea.
That's a really good idea? Okay. And this just goes over some more reasons for you. It's also budget friendly. I know your kids are in that university stage, right? Mm-hmm. So we want to make sure that we have a little dispensable income. That'll be also really nice for you in retirement, or you could use it on the golf field. Mm-hmm. All right, and there's some more information here about getting support and some medicine and setting a quit date. Do you have a quit date in mind? Have you thought about that?
I could do January next year, 2023.
Okay, definitely. So that gives us ample time to plan it, and then we can write out some more motivational tactics for you and what we can discuss. Would it be okay if I send a referral over to your doctor to discuss some different options about nicotine replacement?
Yeah, that's a good idea.
I know you've tried the gum before as well.
And I tried the patch for a little bit as well.
Okay, things have improved since you've last tried to quit, so definitely that'll be helpful. There are some, I just want to make sure that we refer you to the doctor so they know your medications and if there's any contraindications. Here is some more information for yourself. Okay. Please take it, read through it, and I'll be more than happy to help you through this process.
Okay, thank you very much. Well, I really appreciate all of these resources you've given me. It's very helpful. I wasn't expecting this many resources from a hygienist, but I really do appreciate it.
You're welcome.
So I'll definitely be talking to my doctor about quitting, and I'll tell him my quit date as well, and hopefully he'll give me some helpful medications or like gum or stuff, and I can maybe even try that again.
Yeah, if you have any other questions, we're always here to help, even if it's just like a quick call. You're like, I just had a quick question about this. Or even if when your doctor does prescribe something for you and you're a little bit concerned about how it affects your oral health, please do feel free to reach out. We're more than happy to help you through that process. Since you do have a quit date in mind, would you consent that I give you a call about like a week before just to see how any apprehensions are, if you started any of the tactics that we talked about, like going for a walk, trying to keep more mindful? Would you consent to that?
Yeah, that's okay with me.
Okay, great. I'll put this note here. And then also I'd like to kind of see and touch base with you how you're doing in 1 month from now. Would that be okay as well?
Okay. And in 1 month from now, do you think my oral health will already be better?
It won't be better. We'll see improvements.
Okay.
And from our last appointment, we did take some pictures of the stain. I know that you're concerned about that. And so we'll take a picture today And then we'll
Okay.
take one again in the next little bit as well.
Okay.
And then you can see the gradual improvement as well.
Yes.
All right, does
All
that
right.
sound great?
Yes. Thank you.
I'm
for
very proud of
everything.
you for making
Thank
this
you.
big change. And I'm happy that you put us and your dental team in part of that.
Yes. Thank you for everything today.
You're welcome.